Hello, guys. Thanks for joining me again. My name is Edith. It's such a pleasure to be with you today talking about prostate cancer. Yeah, I know some people would have 1,001 questions about prostate cancer and would be wondering what this is all about. Why is she talking about prostate cancer? Who has prostate cancer? Is that even a name of something? Yeah, but today I'm going to be going into the world of prostate cancer and talking about how to identify prostate cancer, how to prevent prostate cancer, how to also manage, and then some screening recommendations for prostate cancer. So please just sit back and join me as we go through this. So first of all, what is prostate? The prostate is a part of the male reproductive system. So the prostate is somewhere just below the bladder, kind of right in front of the rectum. So when I say the bladder, it's just the collecting bag, or, in a layman's term for, the bag that collects urine. And then when it fills up, it passes a message to the brain, and then the brain, tells you it's time to go to the bathroom. So that's your bladder. And then your rectum is just a passageway for stool. So somewhere in there, in front of below the bladder, it's towards the back. And if you've ever happened to go for a digital rectal exam, which is pretty much what physicians were using in the past to check for prostate cancer, you could see your doctor, maybe insert a finger through the anus and try to feel the prostate, if it's enlarged or if it's normal in size. So yes, that's the prostate, and it's in men, it's not in women. So, but hey, if you're a woman, you still need to hear what I have to say today, because if you love that man in your life, if you love that son of yours, if you love that husband of yours, if you love that brother of yours, and they are 40 years old, you need to advise them to go get their prostate checked out. Now, the prostate is very small. I'm sure some people will be wondering, the size. It's not as big as, a lot of us have imagined. It's a very, very, very small, I kind of call it like a gland. It's somewhere down there, but it's really small. But it can, of course, with time, with infection, with cancer, it can expand. And then even with age, sometimes age makes the prostate grow bigger. Now, the prostate gland with the sperm cells from the testicles, they kind of supply some fluid that make up the semen. So it's not totally unuseful, or it's not something that is of no value. It provides the sperm with some fluids and helps the muscles of the prostate, also helps with ejaculation. So when the sperm is coming out of the penis, the prostate muscles help contract and push out the sperm from the penis. Now, as men grow older, the prostate get bigger. So if you go to the doctor's office and you do some tests and they tell you your prostates are bigger and you're 55 or 60 or 65, you really shouldn't be so worried about it. So, but the bigger prostate begins to block the flow of urine from the bladder. So as the prostate gets bigger, it begins to kind of constrict or make smaller. It tightens up the urethra, or it tightens up the duct from where urine comes from, and that can also affect sexual function. Now, this is called benign prostate hyperplasia, which is BPH. I'm sure if you've never gone to have your prostate checked, if you've never had issues maybe with urination or with having erections or with ejaculations, you probably haven't heard about that. But yes, BPH is when the prostate expands and begins to constrict, cause a difficulty in passing urine. Now, BPH is not cancer. If you've gone to the doctor's office and they do a prostate-specific antigen, which tests basically for the prostate, it tells us about the state of the prostate. If you've ever gone for that test and the doctor says, hey, you have BPH, or you have your prostate-specific antigen is increased, it doesn't necessarily mean you have cancer. But in some cases, people might need surgery to correct a benign prostate. And it's called benign because it's not cancerous, it's benign. If it was cancerous, it's not going to be benign, it's going to be metastatic. Now, the symptoms of BPH might look like cancer symptoms. Yeah, and I'll be talking about the symptoms in just a minute. Now, what is prostate cancer? Prostate cancer is when the cells, when malignant cells now gather around the prostate, now causing the prostate to be enlarged in size. Prostate cancer grows usually slowly, but of course, the reason for this presentation is to emphasize on the importance of screening, importance of prevention, importance of management. So if you have the privilege of going to the doctor's office today, I mean, you're 40 years old, you want to go find out about the state of your prostate. Now, prostate cancer grows slowly, and of course finding it and treating it early can help with the management of the disease. Now, prostate cancer is the most common cancer and the second leading cause of cancer death among men, of course, here in the US. That's where I have some statistics. Now, some of the symptoms of prostate cancer include a need to urinate frequently. So you gotta go to the bathroom like every 10 minutes. It doesn't matter if you drank water or not, you're rushing to the bathroom. It could also be, especially like at night, if you're having to wake up too many times at night, then it's time for you. Don't take it for granted. Don't just overlook it. It's time for you to go see your doctor and get your prostate checked out. It could also be difficulty starting urine. So you go to the toilet to pee, and you bring out your penis and the urine is not coming out. It could also be difficulty, like when the urine comes out, it comes out and stops, it comes out and stops, but your bladder is still full and you need to pee. It could also be painful urination. You could have pain with urinating. It could burn when you're urinating. It could be dribbling, like, flowing, but, very, very slowly, unlike you used to do before. It could also come in the form of a difficulty with an erection. So some people may have a difficulty having an erection or maintaining an erection because of an enlarged prostate or some cancer in the prostate. It could be a difficult or painful ejaculation. It could be a decrease in the amount of fluid ejaculated. So it doesn't matter if you are 40 and 45 or even 20. If you begin to notice that the quantity of the sperm or semen, whatever you ejaculate, is beginning to decrease, then it's time for you to pay attention to your body and maybe go get yourself checked out. It could be blood in the urine or blood in semen when it comes out. It could be pain in the rectum, in your anal area. It could also be pain and stiffness or any kind of discomfort in your back, lower back especially. Now, does prostate cancer affect erection? Of course it does in some areas, but the reason for those problems with erection are not necessarily prostate cancer related. So symptoms are symptoms, and no matter what, most likely to be the causing symptom, you need to go get yourself checked out. It doesn't matter what's going on. The moment you figure out that something is not right with you down there, you need to go see a doctor. All right, so we're talking prevention. Cancer prevention is any action taken to lower the chance of getting cancer. And that is why I am doing this. I'm taking so much time out of no time, putting in a lot of resources together, to present to you some of this information, because I have seen people who could have avoided certain types of cancer, especially prostate cancer. Now, if prostate cancer is caught in the early stage, it is very easy to manage. But then the problem comes when there is a metastasis, when the cancer cells leave the area, the origin, the state of origin, or whatever, as I like to call it, and then they travel from the prostate maybe to the liver or to the kidneys or to the lungs, then yes, it becomes a very difficult problem. And then some people have lost their lives because they didn't take early precautions. Now, by preventing cancer, we can all come together to reduce the number of deaths related to cancer. Hopefully, this will lower the number of deaths and prevent new cancers from starting. All right, so there are some risk factors and there are some preventive factors. I always like to talk about risk factors, both the modifiable, which are the ones you can change, and the non-modifiable factors, which are the ones you necessarily cannot change. So anything that increases your chance of developing any illness, cancer, whatever, is a risk factor. Now, some you can avoid, like I said, and some you can't. For example, smoking, drinking alcohol, and certain genes are all factors that expose you you to cancer. Now, regular exercise, a healthy diet, no alcohol, no drinking can all help you prevent cancer. Now, let's see something else. I'm going to talk real quick about screening because I'm trying to keep this really, really short. Screening is whatever you do to look for cancer or to prevent them before they come. So this can help catch cancer. It can help prevent cancer, and it can help catch it at an early age, and that's an early stage. And that is what this presentation is all about. So there are screenings that any man who is at a certain age has to go for in order to figure out if they have cancer or if they need to do something to stop, prevent them from having it. So the PSTF recommends that men between 55 and 69 years old get screened for prostate cancer. Now, it's your choice. You don't have to do it. It's just a recommendation. But think about it. If you're able to catch it earlier, then that even increases your lifespan. Yes, it could be really scary to know that you have cancer, but think about it. It saves you from, premature death. It protects your family. It saves your family from going through the pain of losing, a loved one and all of that. So there are so many treatment options. You go to the doctor's office. The normal PSA level is usually about, I think, 0 to 2.6, and then from 2.6 to 4, you need to do something. And in some cases, some people have over 4. The PSA, which is a prostate specific antigen, which directly tells us, about the state of the prostate, it could be really, really elevated in some people. Now, like I said, when older men, the PSA levels could be elevated. It doesn't mean that they have prostate cancer. In certain cases, like prostatitis, where there is an infection or inflammation of the prostate, there could also be increased levels of PSA, and that is where more study or more diagnosis is needed to determine if it's just a localized infection or age-related elevation of PSA or cancer-related elevation of PSA. So regardless of what the situation is, you need to take care of yourself. You need to go see a doctor. Maybe every year, get your PSA levels checked. If you're 50, I know it used to be like 40. People go for prostate cancer screening from 40 years old, but we have all these guidelines that keep changing, and I wouldn't be surprised. But if I was you, I would try to take advantage of it. Now, there are so many treatment options. Okay, you go to the doctor's office and he says, hey, your PSA level is a 6. And, what do? You want to go probably have a biopsy of the prostate tissues and figure out if it's cancerous or not. So, okay, you go to the doctor's office and they say, your PSA is elevated, the biopsies show a positive for cancer, then what do you do? So there are so many treatment options. The doctor could suggest that you just wait and watch it. The doctor could also suggest surgery. And I know, the goal of this is not to tell you what to do. I'm not a doctor. I'm just an educator. So I do not prescribe. I do not recommend, but I can expose you to some of the available options so that when you get to your doctor's office, when he's talking about some of these things, you actually know what he's referring to. So surgery could also be a choice. There could be a total removal of the prostate, and some of the tissues around the prostate. There could also be radiation and chemotherapy. Hormonal therapy could be involved in the management of prostate cancer, immunotherapy, and biphosphonate therapy. All right. So how does this affect your sex life? I know that's the question. How is my prostate cancer, or how does my prostate enlargement, or how does the state of my prostate affect my sexual life? So keep in mind that sexual issues from your prostate cancer or whatever, I'm going to talk about sexually related issues in the future, but I want you to know that whatever affects you in any way sexually affects your partner. So it's not something you're going to shy away from. It's not something you want to just, pretend that your partner doesn't know about. Whatever is going on with you, your partner knows it. He or she feels it. So you don't want to keep it away from your partner. Then a man's partner can become frustrated and stressed out from a sudden, sometimes long-term change in sex, in their sex life. So anything that affects you sexually, and it happens to be for a long run, in a long run, might in some way directly and indirectly affect your partner. Now, but we recommend that couples who are going through this seek some kind of counseling. Your spouse could be really worried about it because they do not understand, what the whole thing is all about. But of course, when you go out there, get some counseling, seek help from qualified people. They can help you out through the process. So that's pretty much it on prostate cancer. I'm going to be talking a little more about this in the future, but objectively, if you're 40 years, 50 years old, and you don't know the situation of your prostate, I want you to go get your PSA levels. When next you go to the doctor's office, tell them you need to get your PSA levels checked. And based on those results, you want to rule out certain things. There are so many other things that can cause an increased prostate, like I had said, but I forgot to mention STDs. Sexually transmitted diseases can also affect the prostate and cause some prostatitis, which is basically an inflammation of the prostate. So thank you so much. I hope this was brief enough. I'm trying to keep my presentations below 10 minutes, but sometimes I feel like 10 minutes is not enough to bring all that information. But thank you. It's been a pleasure talking to you today. I look forward to seeing you next week. Have a blessed new week. Bye-bye.